Hi, I'm Dr. Deeptee Jain, and I'm an orthopedic spine surgeon. Are you wondering what's causing your back pain and you just haven't found the reason for your back pain? Well, in this video, I'm going to talk about what some of the most common causes of back pain are most frequently missed. The most common thing that I see, now this isn't something that's going to be missed by other spine surgeons, but frequently it can be missed by people who are not experts in spine care, whether that be primary care doctors or even radiologists on MRI findings. One of the most common causes of a misdiagnosis that I see, or a diagnosis that's not recognized, is what's called spondylolisthesis. That means that there is some amount of instability in the spine or abnormal motion. What that means is that sometimes with that abnormal motion or one vertebra in front of another, the nerves can get really irritated. And so I think that a lot of non-spine care providers haven't necessarily been trained, nor should they be trained to actually pick that up. But also, if we're trying to make a diagnosis on an MRI, keep in mind, when we get x-rays, we're typically standing up. Most MRIs are done with the patient lying down. And so a lot of this abnormal motion or instability actually goes back into its normal place when a patient is lying down. And so it might not be seen on the MRI. It might be something that needs a stand-up x-ray in order to detect it. And so that's one of the reasons I think that this diagnosis is very frequently missed. The SI joint is also potentially another frequently under-recognized source of pain. Now, there are some doctors who, believe it or not, think it's a real source of pain, and other doctors who don't think it's a real source of pain. The reality is I don't really actually know the answer, other than to say I think it should be considered as a source of pain. And so because it's not necessarily that well recognized, I think that that could be a reason why it's sometimes missed. So SI joint pain typically presents as pain that's localized in the area that's between the buttock and the low back. And patients will often present with pain in this area, and on exam, when I examine them, they'll have some tenderness in the area. Now, there are a lot of other things that can also cause pain in that area, so it's definitely not a straightforward diagnosis, but things like injections that can be performed that can help us make this diagnosis. So keep in mind, there are also a lot of non-spine related causes of back pain. Basically, any sort of structure in the abdomen can present with pain that radiates to the back. So the kidneys, for example, and in fact, just yesterday, I saw a patient who had a kidney stone and she had really severe back pain, as well as what we call flank pain. And so when I examined her, I actually tapped on where her kidneys are and she jumped in pain. And then when I looked at her imaging findings, I actually saw that she had a kidney stone. And so that is something to keep in mind, especially if you're presenting with back pain and then you're going to see spine care providers. Because keep in mind, as a spine surgeon, I am definitely not an expert in things that are not spine related. And so really important to keep in mind that there are other causes and to talk to doctors like your primary care doctor about things that can cause pain in that area. As spine surgeons, we are trained to look at the spine and the spine only. And so we frequently don't necessarily pay attention to the other areas of the body and the other organs, all of which can be contributing to pain potentially. And so this is what I would call a diagnostic blind spot. And it's really common. If someone presents with back pain, it's really reasonable to assume that it's coming from the back. But just keep in mind that there are other sources that are important to rule out. When you've tried things and you're still having a lot of back pain, whether that means physical therapy, whether you've tried different kinds of medications, whether you've tried things like traction or massage, that's a time where, it really just depends on your symptoms. If you're really experiencing a lot of pain and your quality of life is impeded, that's when it's appropriate to seek care from a spine specialist. So keep in mind, if you're having back pain, while a lot of back pain does originate from the spine, there are other causes of back pain that are not spine related that should always be considered.